Welcome to Dateline Health. This is Fred Lippman coming to you from the Allen B. Levan Innovation Center, a cooperative venture between Anova Southeastern University and Broward County. And here we have a wonderful subject matter. It relates to weight loss surgery and new guidelines. And we have an expert, a medical director of the Bariatric Program at Broward Health Imperial Hospital, Dr. Zhang. Well, welcome, Dr. Zhang.
Welcome. Thanks for having me.
Good to have you, sir. I was just reviewing some of my nightly readings, and there's been some very interesting new news about the issue of obesity in children, but we'll get to that. But it is a perfect time to talk about weight loss surgery, and I know that there's new guidelines that have been just set forth after 31 years of bariatric surgery and guidelines for weight loss. So it's all yours.
We are a comprehensive bariatric center, which means we offer support for the patient in terms of mental health, patient support groups. We also offer a wide variety of bariatric surgery, including the gastric bypass, the gastric sleeve, and revision surgery. On the topic of the bariatric surgery guidelines, is an exciting topic because this is a topic that hasn't been visited in over 31 years. The original guidelines that were created by the National Institute of Health from 1991 have obviously been outdated. So the societies finally got together and we published the new guidelines. The biggest things about the guidelines is that we've lowered the recommendation for bariatric surgery in terms of patients' weight. What that ultimately means is, we double the population of the current U.S. are going to benefit from bariatric surgery. The big points are previously bariatric surgery was recommended for patients with a body mass index of 40, which puts them in the morbidly obese category. We have now lowered that standard to 35. So if your body mass index is above 35, you automatically qualify for bariatric surgery. Previously, if your body mass index was 35, you needed to have one of these obesity-related comorbidities. The big ones are diabetes, high blood pressure, high cholesterol, sleep apnea. But now that's been dropped to 30. So if your BMI is above 30 and you have one of these comorbidities, you also now qualify for bariatric surgery. Also, a lot of data we've shown that obesity as a disease impacting cardiac health begins different depending on people's ethnicity. So one of the other major points is certain ethnicities, especially Asians, that BMI number has dropped to 27.5 because studies have shown that diabetes, high blood pressure, cholesterol, all these comorbidities show up at much lower weights in the Asian population. But like I said, the exciting news is basically we're going to be able to offer this life-changing surgery to a lot more patients.
And reading the documents that you just referred to, and I just skimmed through them, I noticed that the percentages relative to the various racial populations, and what it amazed me is the youth of the patients also. We are seeing much more obesity in what I would call young adults and children than ever before.
Yeah, I mean, like I said, obesity is definitely becoming more prevalent, right? In the last decade, it's now the second most likely preventable cause of death after smoking, right? So what we've seen is, when people are obese, they are more prone to having these like diabetes, heart disease, cholesterol. And by being obese, you really increase your chance of having a cardiovascular related event by over 90% compared to somebody who's not obese. And obviously, as younger people get more obese, the goal is to really sort of fix the problem before it becomes a problem. We're trying to sort of promote bariatric surgery more as a preventative care these days in the younger population rather than as a treatment after the fact.
Dr. Zhang, just for the viewers now, this program really which we're in our 23rd year, comes from questions from the people that are viewing us from out there. And would you explain, number one, what BMI is and what, your surgical issues, the surgical techniques that are involved in bariatric surgery? Would you mind doing that?
Yeah, BMI is body mass index. It's sort of how the medical community qualifies obesity. It's a ratio of your weight squared over your height. But what it does is it categorizes people based on your height, what is the ideal body weight? It is basically it's actually based on data from insurance companies. Conveniently, where basically people have written papers based on people's height weight ratios, sort of what their sort of life expectancy risks are, right? So these are actually actuary tables that they've used in the past. And when they sell insurances, they're like, if your weight is a certain BMI, you're a much likely chance of dying, and that's your risk of insurance is much higher. But it's also translated into the medical community because it gives a standardized way for us to look at patients. So generally speaking, the BMI scale is, if your BMI is the ideal scale is probably between 22 and 25, which is normal. Above 25 to 30 is considered overweight. From 30 to 35 is class 1 obesity. 35 to 40 is class 2 obesity. Above 40 is morbid obesity, and above 50 is super obesity. But the big picture is basically if your BMI is above 30 in the sort of class 1 obesity, you are now a potential candidate for bariatric surgery.
As you probably know, being here in the South Florida region, that the state of Florida has the highest number of people over the age of 70. The greatest, I'm talking about percentage-wise, and the greatest number of people over the age of 80 of any state in the United States. But in reading all of the documents that have been recently released, it really brings me to the view of the people who often watch us. They have grandchildren and children that are out there that meet the standards that are being looked at now, with BMI being lowered relative to that, because obesity is really almost endemic here in the United States. What do you have to say to that?
Yeah, I think obesity definitely is a epidemic or endemic. I think we saw a lot of it also. The COVID situation also brought it into the forefront, because obviously during COVID, the data clearly showed that if you're morbidly obese or you're obese, you're a much higher chance of having a complication if you got COVID. So that's just another sort of sign that being overweight is definitely putting you at much higher health risk. In terms of the age thing, that was another thing I forgot to mention, is that in the new guidelines, actually, we have erased an upper limit age limit for bariatric surgery. So in the past, it was really considered, in the original guidelines, 65 was sort of considered the upper limit for surgery. But what we found is, as sort of lifespans expand for patients, the benefit of bariatric surgery is a 10-year benefit. What I mean by that is, if you get bariatric surgery, like I said, you're reducing the risk of a cardiovascular event by 90% over the next 10 years. So as long as you believe the patient is going to have a lifespan past 10 years from the date of surgery, they're going to gain the benefit. So, we don't put an age limit anymore. I've operated on patients in their 70s, because if they're healthy at 70 and they're going to make it to well into their 80s and their 90s at this point, then they're going to benefit from bariatric surgery.
Well, I think that's a very important factor. God bless the folks that we see on a daily basis. I had the privilege of having a mom that lived to be 92, and she never said that she was old. She always said that don't call me a senior citizen, just call me and tell me you love me. The bottom line is that bariatric surgery has changed dramatically too, and I want you to discuss, because I know now there's minimally invasive techniques that are used in bariatric surgery, which is a major issue to our viewers. We have three major topics that are always spoken to us of, because most of our programming relates to questions that come from our viewers, and the three most referred to topics are heart disease, cancer, and surgical pain and things of that nature. So with minimally invasive techniques, I would assume that there is now utilizing robotic surgery and things of that nature. Am I correct?
Right. So we do our surgeries here with robotic surgery or robotically assisted laparoscopic surgery. That has changed that has really changed bariatric surgery because, in the old days when this was an open operation, it was a big incision, patient would be in the hospital a week or two, you had a large wound you had to take care of. With, robotic surgery or laparoscopic surgery now, these operations are done, the surgeon time is about an hour and a half. Most patients stay just overnight. So, you're talking about a 24-hour hospital stay and you can go home. The pain is minimal because we use small incisions. The biggest incision is 1 centimeter. So pain is really not an issue. For most of my patients, I don't even send them home on pain medication. Most of them can just go home on Tylenol.
Is there I would assume there's a relationship in your area of the bariatric program at Broward Health between yourself and co-professionals. For example, I would assume that there are nutritionists that are brought into the subject area and things of that nature, certain exercise monitoring and things of that nature. Is that correct?
Yeah. So that's what our comprehensive program offers, right? So we offer, number one, from the consultation until surgery, you have to see certain clearances, whether you need to see the cardiologist, whether you need to see a psychologist to help with the mental health. We run support groups once a month. The support group is run by my bariatric coordinator, and she herself is a previous bariatric patient. So we also we actually have an app on the phone for the younger generation. It's called Bariatric, and on there it has sort of all the information. It also is an app to allow you to track your diet, your exercise, and then when you see our nutritionist, we have a dedicated bariatric nutritionist. If you're using the app, the nutritionist can pull up your data on the app, and he can look specifically at what you're eating, and he can give you specific advice. I think the main thing I always tell patients, bariatric surgery is a little bit different than other surgeries we do in the sense that, with bariatric surgery, what we're giving patients is a tool for change. But unless the patient knows how to use it properly, they're not optimizing the surgery. And that's really what the comprehensive program allows us to do. It not only do we give the patient the tool, but we give them very detailed instructions and guidance on how to use it properly.
In relating to some of the details, then there was some subject area that was not necessarily released by the federal government, but then there was some articles that were there that were written by colleagues of yours and others, and they were viewing the difference in the number of obese individuals at younger ages due to what I would call, I don't want to use any brand names, but the multiple quick eating venues, all right? I don't want to use any names, but do you find that our ingestion of different food items have created this obesity issue?
Yeah, definitely. I mean, I think when we look at obesity from an evolutionary standpoint, the human body was not designed to deal with obesity. What I mean by that is evolutionary. If you look at it, right, food was always scarce, right? So, if you look back, supposedly when I tell patients, like, look, when the human body was created, when we were cavemen, we were worried about food, right? Because food wasn't so plentiful. So the body is designed to hold on to food. So what's happened now is we've sort of had a 180, and now not only is food readily available, we have sort of a lot of processed, readily available foods. And now the human body, has never been designed to worry about eating too much. And now that's sort of where we are. We've sort of, because of the evolution of how things are from an evolutionary standpoint, food is so available now, the human body does not know what to deal with all this excess food, especially all this processed foods. But in terms of, process or foods, yeah, that data has come out strictly from the Asian population. When they've done studies when you know Asian populations that have been as sort of more processed food has entered that community, obesity rate has definitely increased in these communities.
I'm just wondering how someone like yourself, who that's a highly trained, skilled medical doctor in the area of bariatric surgery and weight loss surgery, what you think about it. What is the reason? Is it that we have a more sedate population in the youth, or is it just the availability of food at all times?
No, I think it's a combination of both. I think definitely, I think lifestyles become more sedentary, right? It's this things, I'm talking to you through a virtual platform, as things have become more technology driven, it's become more sedentary. And then, like I said, there are more available cheap foods that aren't necessarily the healthiest food. Right? And that's what I mean when I say, as a program, it's about, the surgery gives the patient a tool to sort of reset and change their lifestyle. But at the end of the day, we're trying to build healthy habits. And that includes, more physical activity and telling patients the right food to eat. So
my question is, does Broward Health have programs that go out into the community?
yeah, we like I said, we give monthly seminars which are free and for patients who are interested in learning about bariatric surgery. I do think that is the other issue we fight as bariatric surgeons is the stigma of obesity. Right? It's one thing for patients to need help, but it's another thing for patients to ask for help because there is a lot of negative stigma with bariatric surgery. Just because weight itself is a big stigma, but also I think there is a lot of social pressure with people if they do bariatric surgery, they do face a lot of social pressures, almost like if they've given up and they can't do it any other way. But I think it's important for patients to understand that obesity is a disease. It's multifactorial, and just because someone diets and exercises sometimes that's not enough, and that's when surgery comes into play. But I do think that is one of the barriers for us to get to patients is because there's a big negative connotation and stigma associated with bariatric surgery. Not a lot of people necessarily want to come seek our help because they feel like that comes with a lot of you know
Two things. Number one is I'm taken back by the fact that a lot of people don't know what bariatric surgery is. All right. My question really is the guidelines that came out talked about weight loss surgery, which I think is more understood by the general population. So when you have these get-togethers or presentations, do you charge them with the idea that they're getting information relative to bariatric surgery or weight loss surgery?
so we like to call it bariatric surgery because ultimately when I see patients I tell them the same thing. My goal is not necessarily to have you lose weight. That is not the ultimate goal. The ultimate goal is to make you healthier, right? That's the reason we do the surgery. I don't see a patient and tell them our goal is to have you lose 100 pounds, 150 pounds, 200 pounds. My goal is to fix your diabetes, fix your sleep apnea, fix your high blood pressure, fix your cholesterol. And that's the metabolic part of it. And that's why, so in the medical community, we call it bariatric surgery because our focus is not necessarily pound for pound, it's more health. So, and that's something else I like, when I see patients, I want them to understand, if I see a patient and their goal is to lose 150 pounds, they only lose 120 pounds, but, their diabetes is cured, their high blood pressure is gone, they're not on the sleep apnea machine. That to me is the ultimate goal. So I think that's why, that's also sort of the connotation that we have to fight is the stigma that it's not a weight driven process we're trying to help. It's really a health driven process we're trying to improve.
with reference to that, every time that we have a program, we talk about cardiac care, or we talk about diabetes, we talk about other things, and here we talk about weight loss, which may encompass as a result of being obese, either one of those items. We often talk about the intake of fluids, and constantly we talk about, on many of our shows, we talk about the over intake of, shall we say, sugar products.
Yes, I mean definitely. I mean part of nutrition and after bariatric surgery is you're very limited on the amount of carbohydrates you can have. Most of the diets are sort of protein heavy, and then the thing is the way the surgery works. Sometimes if you have a large amount of sugar, you can have side effects that make you uncomfortable after the surgery. So some of that's one way the surgery sort of helps the patient because physically they are going to be limited in the amount of carbohydrates they can take in because they can have side effects, uncomfortable side effects that sort of remind them not to do the right thing.
Okay, well, if someone wants to contact the bariatric program at Broward Health Imperial Point, we would like to have your contact numbers, and we'll put it up on the screen. I'm going to ask you to offer your last comments on what do you think is the most important thing that the people who are viewing this program today to check off on a short checklist. Go right ahead.
I think as I said, the main thing is, I want to let the audience know that, like I said, bariatric surgery guidelines have expanded. We can now offer the treatment to a lot more patients. I know there's a lot of patients out there who suffer from obesity and its consequences. And, the surgery works very well. I mean, this is a life-changing surgery. I mean, we're fixing people's diabetes, their cardiovascular disease. And like I said, ultimately what the data shows is if you're obese and you have one of these comorbidities, by having bariatric surgery, we will decrease the chance of you having some sort of, medical issue related to it by 90% over the next 10 years. And so we're really offering a life-changing procedure. And I'm glad the societies have recognized that how impactful it is, and we can now offer it to a lot more patients.
Well, often, and we've done shows over the years relative to bariatric surgery when it first came into, I guess you could say, certified effect in the medical community here in South Florida. But I think that the folks that have asked us questions over the years relative to bariatric surgery really often are interested in weight loss surgery. And even though it's the same item, I really think that weight loss surgery should not be looked at just as I want to look pretty or I want to look handsome. It's more like I want to live. I don't want to die of cardiac disease. I don't want to have the scourge of having diabetes. Is that what you find?
Correct. Yeah. Like I said, that the surgery is designed. The goal of the surgery is to make people healthier. The weight loss comes with it, but that is not our primary goal.
Well, we really appreciate your expertise, and we congratulate the Imperial Point, Broward Health Imperial Point Hospital for establishing the bariatric program. I think it's of great value to the people out there that have asked us for a long period of time about obesity and how do I lose weight and how do I protect myself. So thank you very much for being here today. We appreciate it, and we thank you and wish you well at your program. And folks, as I always say, this program is created to answer your questions, but hopefully it entices you to not just let your health care sit in your mind. You have to communicate with your physicians. Your physicians are the conduit to programs like the bariatric program, the cardiac program, the cancer therapy program, whatever it might be. Remember, this program is called Dateline Health. We have an address and an email address and a phone number right here. If you have any questions, just send it your way. I won't answer them, but somebody will. Remember, this program is called Dateline Health. My name is Fred Lippman. Until next time, see ya.